Hello learners, welcome to today's video session of Module 3 titled Hazards and Ailments During Early Childhood. In our previous two sessions, we discussed developmental hazards that young children may face, covering both physical hazards like accidents and illnesses and psychological hazards such as emotional stress and social difficulties. Today, we are shifting gears to talk about something equally important, that is, identifying the common ailment and taking care during early childhood period. Whether you are a parent, teacher or caregiver, this session will equip you with practical knowledge to identify, prevent and manage health issues in young children effectively. After all, keeping children healthy and safe is not just about caring for them, it is about empowering them to grow and thrive. Early childhood is a time of rapid physical and cognitive growth, but it is also a stage where children are more vulnerable to health problems due to their developing immune systems and active lifestyles. A seemingly minor health issue, if it is left untreated, can disrupt learning, play and social interactions, affecting a child's overall development. That is why early identification and prompt care are key to manage these challenges effectively. In this session, we will take a closer look at infectious diseases which are caused by bacteria, viruses and parasites and which can spread quickly in shared spaces like schools and daycares. And we shall also talk about non-infectious ailments, that is health conditions that do not spread but can still impact a child's well-being, often resulting from genetics, environment or lifestyle factors. Then we shall talk about basic first aid practices, that is simple and effective steps you can take to respond to emergencies, provide immediate care and prevent complications before professional help arrives. By the end of this video, you will be able to recognize and address common ailments and infectious diseases in preschool age children, apply preventive measures to reduce risks and curb the spread of illnesses, perform basic first aid techniques designed specifically for young children to handle emergencies confidently. So, let's get started. We will begin by exploring infectious diseases, how they spread, their signs and symptoms, and what steps you can take to prevent and manage them effectively. As we have already mentioned, infectious diseases are caused by pathogens such as viruses, bacteria or parasites. They can spread easily through direct contact, respiratory droplets or contaminated surfaces, especially in places where children play, learn and interact closely. Let's explore some of the most common infectious diseases affecting young children. Firstly, we shall talk about respiratory infections like common cold, influenza, pneumonia, whooping cough or pertussis. The causes are, they spread through airborne droplets when an infected person coughs or sneezes. They also spread on coming on contact with contaminated surfaces like toys, decks or doorknobs. Symptoms include, for common cold, runny nose, sneezing, mild cough and low-grade fever. For influenza, the symptoms are high fever, body aches, fatigue and sore throat. For pneumonia, symptoms are cough with phlegm, difficulty breathing and chest pain. And for pertussis, severe coughing fits followed by a whooping sound. Preventions are, number 1, encourage frequent hand washing and use of sanitizers. Teach children to cover their mouth and nose with tissues or elbows when coughing or sneezing. Maintain ventilation and clean shared surfaces regularly. Ensure that vaccinations like DPT, flu shots, etc. are up to date. Management include, number 1, provide rest and plenty of fluids to keep children hydrated. Use saline drops for nasal congestion and keep children in a humidified environment. Consult a pediatrician for antibiotics if the infection is bacterial, for example in case of pneumonia. Next we come to gastrointestinal issues. These include diarrhea, dysentery, rotavirus, food poisoning, etc. The causes are, number 1, consumption of contaminated food or water. and then poor hygiene practices or exposure to infected individuals. Preventional measures. Number 1, promote hand washing before meals and after using the toilet. Ensure safe drinking water and properly cooked food. Wash fruits and vegetables thoroughly before consumption. Rotavirus vaccination is recommended. Symptoms for diarrhea, frequent loose or watery stools. For dysentery, stools with blood or mucus, abdominal pain and fever. Next symptom is vomiting, that is nausea, stomach cramps and dehydration. Now how to manage? Number 1, provide oral rehydration solutions, that is ORS, to prevent dehydration. Feed bland and easily digestible foods like bananas, rice and toast. Avoid junk food and sweets until recovery. Seek immediate medical help if symptoms are severe or prolonged. Next we come to the skin conditions like chickenpox, impetigo, scabies, hand, foot, mouth diseases, etc. Causes of these conditions are direct contact with infected skin or contaminated surfaces, and they also spread through scratching and touching affected areas. Symptoms for chickenpox: itchy rashes, blisters, mild fever and fatigue. For impetigo, yellowish crusty sores, usually on the face, hands or legs. For scabies, symptoms are intense itching and rashes caused by tiny mites. And for the disease hand, foot, mouth disease, sores in the mouth and rashes on the hands and feet. How to prevent? Number 1, teach children not to share personal items like towels, combs or utensils. Maintain cleanliness and ensure frequent bathing with mild soap. Keep nails short and clean to prevent scratching. Disinfect toys and frequently touch surfaces regularly. And how to manage? Number 1, use antiseptic creams and soothing lotions as prescribed by doctors. Isolate infected children until the symptoms subside. For chickenpox, avoid scratching and use calamine lotion to ease itching. Seek medical advice if rashes worsen or are accompanied by fever. Then we come to the systematic infections like measles, mumps, rubella, scarlet fever, etc. The causes of these infections are they spread through airborne respiratory droplets or direct contact with infected individuals. The symptoms include for measles, high fever, cough, runny nose and red rash that starts on the face and spreads. For mumps, swelling of the salivary glands, fever and muscle aches. For rubella, mild fever, pink rash and swollen lymph nodes. And for scarlet fever, sore throat and sandpaper-like rash and accompanied with high fever. Prevention. Ensure that routine immunizations like the MMR vaccines are given. Maintain good hygiene practices and avoid close contact with infected individuals. Monitor for early symptoms and isolate sick children to prevent outbreaks. Management. Provide rest, hydration and paracetamol for fever relief. Follow isolation guidelines to prevent spreading the infection. Seek medical advice for supportive care or antibiotics as required. Vector-borne diseases. Examples like dengue, malaria, chikungunya. The causes are they spread through mosquito bites, particularly in areas with stagnant water where mosquitoes breed. Symptoms for dengue, high fever, rash, muscle pain and bleeding gums. For malaria, fever, chills, sweating and fatigue. And for chikungunya, the symptoms are joint pain, fever and skin rash. For vector-borne diseases, the prevention include number 1, use mosquito nets, repellents and protective clothing. Avoid stagnant water accumulation around homes and schools. Regularly clean water tanks and cover them properly. And management. Firstly, ensure hydration and monitor fever regularly. Use cold compresses and pain relievers to ease symptoms. Seek immediate medical attention for severe cases or complications. By staying vigilant and implementing the preventive measures, we can significantly reduce the spread of infections and keep children safe and healthy. Always maintain open communication with healthcare providers and ensure timely vaccination and checkups. Now, let us shift our focus to non-infectious health issues that commonly affect children during their formative years. Unlike infectious diseases, non-infectious ailments are not caused by pathogens like bacteria or viruses, and they do not spread from one child to another. However, they can still have a major impact on a child's health, comfort, and overall well-being if not identified and managed properly. During early childhood, children often experience general health issues that arise due to factors such as genetics, lifestyle choices, environmental exposure, and nutritional deficiencies. Although these conditions are not contagious, they require attention and careful management to support healthy growth and development. Non-infectious health problems can affect a child's daily activities, learning abilities, and emotional well-being. Addressing these conditions during early stage helps in prevent long-term complications, promote healthy habits, build resilience and confidence in children. Now, let us get started by taking a closer look at some of these non-infectious ailments, beginning with headaches and migraines. Headaches are one of the most common ailments in young children. They can occur due to dehydration, fatigue, stress, or even eye strain caused by excessive screen time. Migraines, although less common, can also affect children and are often triggered by bright light, loud noises, or hunger. Symptoms for headaches are persistent pain in any part of the head, which may be mild, throbbing, or sharp. For migraines, intense pulsating headaches, often accompanied by nausea, vomiting, and sensitivity to light or sound. Prevention tips are: number 1, stay hydrated, that is, ensure that children drink plenty of water throughout the day. Adequate rest, that is, maintain a consistent sleep schedule to avoid fatigue. Healthy meals, provide nutritious meals at regular intervals to prevent hunger-related headaches. Screen time limits, reduce screen exposure and encourage eye breaks during activities. Identify triggers, observe patterns and avoid known triggers like loud noises or certain foods. Management strategies: rest in a quiet, dark room. This helps the child relax and recover. Cold compression, apply a cold pack to the forehead for relief. Mild pain relievers, use medications like paracetamol or ibuprofen if recommended by a doctor. Consult a pediatrician. If headaches or migraines become frequent or severe, seek medical advice. Next, we come to toothaches. Toothaches are another frequent concern among preschool children, often caused by dental cavities, gum infections, or tooth decay due to poor oral hygiene or excessive sugary foods. Symptoms: pain in the teeth or jaw, which may be throbbing or intermittent, sensitivity to hot or cold foods and drinks, and next, swelling or redness in gums. Prevention tips: encourage daily brushing. Teach children to brush twice a day with fluoride toothpaste. Promote flossing. Help them floss to remove food particles and plaque. Limit sugary snacks. Reduce consumption of candies, chocolates, and soft drinks. Regular dental checkups. Schedule routine visits to the dentist for early detection of problems. Then management strategies. Warm salt water rinse. Rinse the mouth with warm salt water to reduce pain and swelling. Cold compression. Apply ice packs outside the jaw to ease discomfort. Pain relief medication. Use pain relievers prescribed by a doctor. Dental consultation. Visit a dentist immediately if the pain persists or if there are signs of infection. Let us now move on to another common problem: neck and back pain. Neck and back pain can occur in children due to poor posture, inappropriate furniture, or muscle strains during play or physical activities. It can also result from carrying heavy school bags or spending long hours in front of screens without proper breaks. Symptoms: pain and stiffness in the neck or back, discomfort that worsens with movement, tenderness or swelling in the affected area. Prevention tips. Ergogenic setup, that is, use properly sized furniture that supports good posture. Limit heavy backpacks. Ensure school bags are lightweight and have padded straps. Encourage physical activity. Promote stretching exercises to strengthen muscles and improve flexibility. Monitor screen time. Enforce breaks to avoid prolonged sitting and neck strain. Next issue is constipation. Constipation is a common digestive issue in preschool children. It often results from low fiber diets, dehydration, or lack of physical activity. Children may also develop constipation due to toilet training anxiety or irregular bathroom habits. Symptoms include infrequent bowel movements, that is less than 3 times a week, difficulty passing stools or painful bowel movements, hard and dry stools, abdominal pain or bloating. Prevention tips for constipation are high fiber diet, include fruits, vegetables and whole grains in daily meals, adequate hydration, ensure that children drink plenty of water and fluids, regular bathroom routine, establish consistent toilet habits to avoid delays in bowel movements, physical activity, encourage regular exercise to improve digestion. Management strategies. Natural remedies. Provide prune juice or foods rich in fiber to ease bowel movements. Hydration. Increase fluid intake to soften stools. Consult a doctor. If constipation persists, seek medical advice to rule out underlying causes and discuss safe laxative options. Next we come to minor injuries like cuts, bruises and burns. Minor injuries are quite common in early childhood due to children's high activity levels and curiosity. These injuries typically occur during playtime, sports or exploring new environments. Symptoms. For cuts and scrapes, the symptoms are bleeding, redness and mild swelling. For bruises, skin discoloration, tenderness and swelling. For minor burns, redness, pain or blisters on the skin. Prevention tips. Childproofing play areas. Remove sharp objects, secure furniture and create safe play zones. Supervision. Always supervise children during playtime, especially in risky areas like playground or kitchens. Protective gear. Encourage the use of helmets, knee pads and elbow pads for activities like cycling or skating. Teach safety rules. Educate children about safe play habits and the importance of following rules during activities. Now, management strategies. For cuts and scrapes, wash hands thoroughly to prevent infection. Clean the wound with running water or saline solution. Use antiseptic cream and cover it with a sterile bandage. Change the dressing daily and monitor for signs of infection like redness or swelling. For bruises, apply a cold compression immediately to reduce swelling. Elevate the affected area if possible. Use mild pain relief creams if necessary and consult a doctor for persistent pain. For minor burns, cool the burn under running water for at least 10 minutes. Avoid ice or ointments immediately after a burn, as this may worsen the injury. Cover the area with a clean cloth or non-stick dressing. Seek medical advice if blisters form or burn affects a large area. By keeping an eye on these common general ailments and knowing how to handle them, you can help your child stay healthy and reduce any discomfort they might feel. Remember, maintaining regular checkups with your healthcare provider is key to early detection and management of any health issues. Stay informed, stay prepared, and take care of those little ones. Now that we have discussed the common health issues children face, let us shift our focus to a crucial skill every caregiver needs, that is, first aid. Whether you are a parent, teacher, or caregiver, knowing basics of first aid techniques can help make a huge difference in preventing complications and providing immediate care before professional medical help arrives. Young children often lack the ability to recognize danger and may act impulsively. Their smaller bodies and developing immune systems make them more vulnerable to injuries, infections, and illnesses. For example, a minor cut or scrape can lead to infection if not cleaned and treated promptly. A nosebleed may seem alarming, but it can be controlled easily with proper steps. Shocking incidents or allergic reactions require quick action to prevent life-threatening complications. That is why intervention through basic first aid is essential, not only to save lives, but also to minimize pain and trauma. Now, let us see what is first aid. Simply put, first aid is the immediate and temporary care given to an injured or ill person before professional medical help is available. The primary objectives of first aid are to preserve life, to prevent further injury or deterioration, and to promote recovery. For caregivers and teachers, first aid is not just a skill but a responsibility, one that can ensure the safety and well-being of young children in emergencies. Key principles of first aid. While administering first aid, it is important to follow these principles. Preserve life. Prioritize actions that sustain breathing and circulation. Stop bleeding. Apply pressure to control bleeding and prevent blood loss. Prevent deterioration. Take steps to avoid worsening the condition, like immobilizing fractures or keeping a child warm during shock. Relieve pain. Use safe and simple measures to reduce pain until professional help arrives. Promote recovery. Reassure the child to ease fear and anxiety. Reassurance and comfort. Emotional support is just as important as physical care, especially for small children. Now, let us have a look at the first aid kit essentials. A well-prepared first aid box is the first step towards effective first aid. Let's take a look at the key items every kit should contain. Bandages of all sizes for covering cuts, wounds, or abrasions. Cotton balls and swabs for cleaning wounds and applying ointments. Instant cold packs to reduce swelling and soothe minor injuries. Thermometer to monitor fevers. Disposable gloves to maintain hygiene. Gauze pads and adhesive tape for addressing the wounds. Antiseptic wipes and creams to prevent infections. Tweezers and scissors for removing splinters or cutting bandages. Medications, basic pain relievers, antihistamines for allergies, and oral rehydration salts for dehydration. It is important to regularly check and update the contents of your first aid box to ensure that all items are usable and within expiry dates. Let us now go through common emergencies and the first aid measures you need to know. Firstly, eye injuries. Ask the child to lie down and face the light. Gently separate the eyelids to inspect the eye. If any object is visible, do not rub or attempt to remove it. Seek medical help immediately. Nosebleeds. Make the child sit upright and lean slightly forward. Pinch the soft part of the nose for 10 minutes while they breathe through the mouth. Avoid speaking, swallowing, or sniffing to prevent recurrence. If bleeding does not stop, repeat for another 10 minutes before seeking medical attention. Insect bites and stings. Wash the area with soap and water. Apply a cold compress to reduce swelling. Remove visible stingers using a credit or debit card edge. Do not use tweezers to avoid squeezing venom into the skin. Monitor for allergic reactions like swelling or breathing difficulty and seek immediate help if symptoms worsen. Now, coming to cuts and scrapes. Wash hands before cleaning the wound to prevent infection. Apply pressure to stop bleeding and rinse the wound with clean water. Remove any debris using sterile tweezers and cover the wound with a clean bandage. Keep an eye out for signs of infection like redness or swelling. As a caregiver or teacher administering first aid, here is what you should remember. Stay calm. Children often mirror your emotions, so staying calm helps reassure them. Assess the situation. Quickly evaluate the injury and ensure the area is safe. Provide immediate care. Act promptly but carefully to prevent the condition from worsening. Seek medical help. If necessary, arrange for medical assistance without delay. Keep records. Document the incident and the care provided for future reference. Remember, preparation is key. Having the right tools and knowledge can make all the difference in handling emergencies confidently and effectively. With this, we have come to the end of today's topic. We have discussed the common ailments that affect preschool children, categorized into infectious diseases like colds, influenza, chickenpox, etc., and non-infectious conditions like headaches, constipation, minor injuries, etc. We also explored preventive measures like maintaining hygiene, ensuring vaccinations, and promoting healthy habits, along with management strategies to handle these issues effectively. Additionally, we covered the importance of first aid, including basic techniques for dealing with minor injuries, nosebleeds, insect bites, and other emergencies. Ensuring the health and safety of young children requires awareness, preparation, and prompt action. By applying the insights from today's session, caregivers, teachers, and parents can create a healthier and safe environment for children to grow and thrive. In our next video, we will move on to another important topic, nutritional requirements of young children. We will discuss balanced diets and their role in growth and development, meal planning to meet children's daily nutritional needs, practical tips for preparing balanced meals at home or school. Thank you for joining today's session. See you next time. Until then, take care and keep your little ones healthy and safe.